Hello, we're at the March 2014 HTRAC Council meeting. I'm joined with Krishna Rao, the CEO from Kannact. Krishna, I know you're here to share your experiences on patient engagement. I want you to share with our audience, please, what are some of your thoughts in general about patient engagement trends and how that's really impacting outcomes?
Sure. What we have been saying in patient engagement is the patient engagement is usually defined as we're going to give you an assessment, try to see who you are, and trying to throw some stuff at you and hope it all works out. The patient engagement in our model has to be, we think, has to be personalized. Each one has a different level of knowledge of their disease. Each one has a different state of mind. Each one has a different learning style, different self-efficacies, and their cognitive styles are different. So unless we understand all aspects of it and figure out not try to go into a very expensive assessment, go into an assessment that takes those into account and makes it more personal for them so they can figure out how to engage with their treatment regimen. That's what we're all about.
That's great. So where do you think that current technologies today and the services that are out there, how are they missing the mark?
It's more than an app. That's one of the reasons we have embarked on actually building a platform. Our platform is, we are not a single app. What we are is, we integrate third-party apps, we integrate whatever it takes to help the patient. In other words, a patient who has a chronic disease has to understand how do they manage their disease. It includes their nutrition, their activity, their sleep patterns, their state of mind. A lot of things have to come together. Their stress levels, how do they manage that? And we try to figure out how we can give them apps, including education content and various advisory tools, so that they can get better at it rather than we just built an app for one specific purpose. That's what we're different.
That's great. That's great. And so, if you would say in 5 to 10 years, where you want to see the industry's adoption of these technologies and how you think the impact will be, where do you see the future going?
Sure. I think we need to separate. One of the fallacies of the whole in the healthcare system is EMR is going to solve the problem. No, EMR tracks. When you visit as an inpatient or even as an outpatient to a physician, EMR tracks the patient. But a patient does a lot of things in between visits. So in between visits is 30 days or 60 days. There's a lot of things happen. And that's where the patient engagement begins. So what we see is more personalized engagement, personalized health management, personalized health records, but at the end of the day, that also needs to tie back to the EMR. So we see an integrated ecosystem made of different systems, but they all collaborate to come together, and they're more patient-centric rather than provider-centric or just a whole bunch of depository of data. I think it's very natural in the industry, just like any other industry. Everybody's starting with the basic premise of putting all the records in the electronic format, but now it's taking all the data in the electronic format to making it a useful information, good analytics, useful information, and also focusing on being patient-centric.
Absolutely. I've already heard today a lot of talk about not just electronic health records, but your personal health records.
Exactly.
The shift is already people talking about we're going to skip population health and go straight to personal health management. Yeah, exactly. It's exciting.
Well, one of the things in population health, there's a weakness. Everybody looks back. It's more about demographics stuff.
Yeah.
There's a couple of things that are very unique in U.S. compared to countries like Denmark or Norway. We're not a homogeneous population. Our ethnic backgrounds, our lifestyles are very diverse. So if it's not a personalized personal healthcare, you really won't get population management. It'll become a joke. So population management has to be a summation of all the personalized health management systems.
Spot on. So in closing, Krishna, I know this is your your first time at an HTRAC Council meeting. We obviously have a very unique collaborative model. I wanted you to share with the viewers what you find valuable about what we're doing.
This is extremely valuable. Usually you're treated as a vendor or you're a buyer. So there are two camps of people moving around. What I really appreciate what this group is doing is it's a collaborating, everybody's sharing, there's really no hard sell. It's like we're trying to learn what's going on in the industry, and the industry is trying to learn what we are about, and then have a good conversation and dialogue about what is right and what's wrong. So I really appreciate that, which is a very different format than what we usually see in a typical vendor-buyer relationship.
Absolutely. That's what I like to hear. Yeah. Well, Krishna, thanks so much, and I look forward to collaborating with you soon.